Hey everybody, it's Salams. I hope you all are doing well today. I wanted to make a video talking about my pre-op appointment with Dr. Mosser. I realized I didn't do this, and my appointment was 3 weeks ago, but I thought this was an important video to make because before my pre-op appointment, I didn't know what to expect, and it really helped me to listen to what other folks experienced, and so I thought I would just share my experience. I was really excited that my pre-op appointment was actually in the office. And I think that was true for me because I live in the Bay Area and he's in San Francisco, so I was able to get over there. It was very easy. Overall, the experience was really great. When we arrived, the staff was very, very friendly. The office was really nice. They had a lot of snacks out. That was exciting. They used my chosen name, which was really cool and very affirming and really made me feel like, the office is really dedicated to honoring people for who they are and for their chosen identities. And that really meant a lot to me. We didn't wait very long, maybe, 7 minutes or something. And we first saw a person who was kind of handling more of the logistics, like the insurance information, the scheduling, all that kind of stuff. And she was great, and she hung out with us in the room until our questions were answered. One thing that was really impressive was there was a question around my insurance and if my insurance was going to cover certain things, and I was confused about it, and she actually left the room and called and handled it before I left the appointment. She had the whole thing handled, which was very, very nice of her, and also, in my experience, very unique because insurance, it's just a fucking pain in the ass. Let's be honest. And so I often have to struggle with doctors around insurance stuff. And I thought that, oh my God, when she told me that there was an issue, I thought that I was going to be on the phone forever trying to figure this out. And she just made a phone call and made it really simple. And I was so grateful. So that was awesome. Like I said, she answered all of our questions, and that was really great. And then she left, and soon after, Dr. Mosser came in. He's a super nice guy, and he sat down, and we had a phone consult. And so he had the file with him, and so he had our previous conversation written in front of him. So he came in knowing what we actually already had spoken about, which I've also experienced in doctors appointments where you talk about something, but then it's like you have to repeat yourself the second time you see them because they didn't review the file. But he had totally reviewed what we had talked about, and that was really nice. He answered all of our questions, and one thing was I was nervous because I forget everything. And so I was like, can I record this conversation? Because I'm really afraid that I'm going to miss some information. And so he was totally cool with me recording it. And we asked a ton of questions, and I'm sure he gets asked these questions all the time. But we asked everything that we could think of, and he was great, answered everything, and was very honest. It was great. After the little Q&A session, he had me stand up and, did I have they had given me a robe. So they had me take my top off and then put this robe on. And so he had me stand up and stand against a wall. And he had me take the robe off, and he was looking at my chest, and it was actually very comfortable. I thought I was going to be more uncomfortable than I was, but the way he handled it was just very, very professional, very comfortable. And so he was just kind of confirming the surgery that we had talked about. So after he looked things over, etc., he then took photos. And so he had me stand in different directions and took photos, and they were all from the neck down. After that, I was sat back down, and I had seen a YouTube video of someone talk about what to ask when you go to your top surgery consult. And I'm really glad that I watched this video. It was a great video. One of the questions was, what are my scars going to look like? And where are my scars going to be? So I did ask him those questions, and he answered them. He basically said the scars are going to be at the bottom of the pectoral muscle. He kind of gave me a sense of what the shape was going to be. He basically gave me options. What he said was, are you okay with this shape? And I said, well, I prefer if it was a little bit more horizontal than curved. And he took notes about that. We also talked about drains, and I didn't realize this, but they are apparently optional, at least with him. And so he's like, you have the choice. He recommended them, so I decided, I'm just going to go with whatever he recommends. But what I liked about this conversation was that I actually had a little bit of say in this procedure, and that was really cool. So overall, the experience was great. I would say the one thing that I was disappointed by was finding out after he examined me and looked at me like in person, he told me that there's really no way around doing the surgery. It's a double incision, but there's no way around doing the surgery without doing a scar across the entire chest. I was really hoping that it would be like two scars, but he said, really, given the way my body is shaped, if we did 2 scars, there would be so much skin bunching in the middle at the end that I would be really unhappy with the result. And he was very clear that he did not recommend going that direction. And so I said, okay, whatever you think is best. I don't know. And I want to have a good result. And he seemed so confident that like doing 2 scars was going to lead to a really unhappy result. I decided, let's just do the scar across the chest. So that's one thing I was disappointed about. I was imagining a different result in my mind. I don't think there's anything wrong with having a scar across your chest at all. It was just sort of what I had envisioned was doing 2 scars, but that's just what my body is like. That's what I need to do. But what I learned from that was that Dr. Mosser really is dedicated to the best possible outcome. He could have easily just made me happy and said, sure, I'll do the other surgery. I'll do it with just the 2 scars, and then had a really negative result, and I would have been unhappy. But what I learned was that he really wants to create like the best possible result. And in every way, I felt that from him, that he was really dedicated to that. And so that felt really good to me. And it gave me more confidence in him actually as a surgeon. So yeah, that was pretty much the appointment. I mean, we didn't talk to him for longer than maybe 15, 20 minutes. Like I said, it was a great experience, super nice guy, super knowledgeable, very respectful. So we left and I was just so excited. I think there was something about going to the appointment that like made the experience very real. Whereas when you think about it or talk about it sort of hypothetically, even if you have the surgery date, it still seems a little bit like not real when you don't go to the doctor's office. At least for me, that's kind of how it felt. Like I hadn't seen him in person. I talked to him on the phone, but there was something so real about it that when I went into the office and we talked specifically, etc. And so I was like so excited. I would say that, I know that I've been making videos. Oh, my cat is about to join us. Any minute now. Here she is. I know that I've been this is Pickle, by the way. She's very cute. She's 10 months old. So I know that I've been making a lot of videos talking about fears about top surgery and thoughts about top surgery, and those have been really important to me processing this experience. Going to the pre-op appointment was such a like reality check, like this is happening, that I felt so excited afterwards. And there was something about the fact that I felt so excited that made me feel like, yeah, even though I have all these fears, I still really want to do this. And that's what's been really cool about this experience, that every time I let myself feel fearful or feel the doubts, ultimately, after I let myself feel all of that, I end up in a place of excitement and confidence about the surgery. And that's really, really important. That's exactly how it felt after I left the pre-op appointment. I just felt so centered and so totally like this was absolutely the right thing. It was a great experience. I hope that your experiences are as positive. I'm curious to hear about people's experiences. So if you want to share, please do. Please like leave a comment. Curious, like if you've seen Dr. Mosser, what your experience was, or other surgeons, or if you were told something that you weren't thrilled about and how you dealt with that. So I hope this was helpful. And yeah, that's it for now. Thanks, y'all.